Quadratus, and have a roller. We'll do the same thing with either the Pilates ball or the pillow, and then have something to stand up against. So it could be the edge of your sofa, or it could be the wall or something. It's just something that you can put yourself against. Yeah. So we'll do a lot of deep stretching we'll work on the quadriceps, we'll work on the hip flexors, and we'll work on creating tone in the gluteal muscles while maintaining space in the low back. So, because you don't want to have your glutes just completely passive and flappy, but a lot of time excessive extra rotation can compress the lower spine. So we'll try and work within those parameters. So why don't we get started? We'll get started with the roller, and we're going to bring it against our quadriceps. Ooh, I just found part of my broken ornament. Ooh, let's get that out of there. Good thing I'm moving. And then here we go. We're going to roll out. And even if you were, like, let's say you were away on vacation where you didn't have your roller available, I do this in my yoga classes, my Pilates classes, and I'll use dumbbells, right? Like little small dumbbells. And obviously you can't roll on them. Or you could use like a rolled up towel, but dumbbells are effective because there's no, or yoga blocks, because you can't cheat, right? They're going to get in there. So I'm at the belly of my my quadriceps, right? And you can either, I'm a personal fan of staying first and then rolling. But if it's too intense, obviously you can just keep rolling. And now we did this yesterday. The heels are turned in, the toes are turned out, most likely. Go ahead and make your legs neutral in rotation. So, right, your toes are pointed down, your heels are pointed up. It doesn't feel good, but it feels like something. It feels like it's effective. And then when you're ready, go ahead and roll yourself just a little bit. So for me, the roller is like my thumbs doing massage, or my elbow or my forearm, right? You pinpoint the location and then you hold on to it, and then you start to move a little bit, right? Just like kind of massaging the tension out slowly and surely, right? So that's what we're doing here. And now start to move down a little bit. Again, try not to let your heels turn in or your toes turn out. Right, so I'm at the third point, so I'm just below the belly of my quadricep. Pretty central in the femur between my pelvis and my knees. And now I'm working my way just beyond the knee joint. And you'll notice my feet aren't on the floor, but they're not tense, right? So if I'm tightening my muscle, what's going to happen is it's going to block the muscle from connecting to the roller, which is then going to inhibit the efficacy of this whole experience. And now we're going to go all the way, the length. So watch here. I'm going to go past my hips or my pubic bone into the front of my hips, my lower abdomen, bend my knees. So bend your knees once you get past your pelvis onto your lower belly. Yeah, there you go. Then release and come up. Oh, doesn't feel good. Right. And back past the pubic bone. Right. And up. And now we're going to go onto our side. Doesn't matter which one, just pick your favorite. And we're going to do that same thing on the IT band, right? So we're going to stop at those 3 points again, right? What's closest to the head and then what's further away. So top of the hip. So I'm going to bring it to my pelvis, and I'm going to feel that little where it's like boom, 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 boom. Oh, now I'm on my thigh. And what happens, a lot of us tend to lean back because it's less intense. I want you to position yourself slightly forward. And another piece of my ornament. And right here, right, it should relax as much as you can. I know it can be like, it's like pressing on a bruise. It feels like innately you don't want to be there. As much as you can, start to let your body position itself forward. And again, now I'm starting to like just the teeniest movement just to kind of extrapolate from this, from the tightness of these tissues. And now I'm going to move down halfway, right? And also, I always find it interesting when I correlate the release, right? So we're on the gallbladder meridian. Gallbladder produces bile, and it does feel slightly bilous. Good, and then we come down more. So now we're right above the knee. And again, here's where, and you might not want to do it, but watch my leg. I'm going to bend and extend. Bend and extend. And we're going to do a cracker jack exercise. Ooh, this doesn't feel good. Bend and extend your knee. Quite intense. Right, and then we're going to go the length of it, right? So all the way up and all the way down. Okay, do that a couple times. My loving husband just brought my energy drink because I was too tired to make coffee. I know it's disgusting. How can you not trust something that's called rainbow unicorn? So 2 more. Last one. And so roll yourself off onto your back. And this is where I like, because I personally like to see it, I feel like this is such a heinous experience to roll out your quads and your IT bands. We'll get to our inner thighs later, but after our sequence. So the leg that you did not have on the roller, the one you did not have on the roller, bring that knee to your chest. And especially because it's earlier morning, you're gonna, I mean, probably for all of us, unless Karen had calls, you know, it's probably early morning for all 3 of us, which makes this more impactful. So pull the knee into the chest. Then note the end range of motion. Now release that leg, the leg you had on the roller. Oh my. It's amazing, right? It's like, and I always equate it to like if you wore skinny jeans and you came home and took your skinny jeans off and put on with your really cozy sweatpants, right? That's your fascia. You just release that much. So that's what we're exploring with in terms of our low back tightness. That ability to pull your knee in, right? Versus this one, that's going to make its way all the way up the entire low back. Well, it's going to make its way up the entire body because it's all connected. But back issues, start with the legs. Start with the thighs. So again, one more breath, enjoy what you've done. Now take that knee, keep it quite close to you, and take your twist. So the higher up the knee, the higher up the release in the back. And since we're trying to bypass the sacrum, right? If your sacrum feels jammed, that's a different story. But right now, we're really focusing on the lower back and the psoas. So we want to keep the knee higher up. And now breathe, send your breath into the posterior lungs on that correlating side. So for me, this would be my left side. I want to feel those posterior lungs inflate. And if it helps you, take your hand to the back body. Right? And feel the lungs press against the back of the ribs, press against and lengthen the QL muscles. And now cross the ankle over the thigh, take your figure 4, and I'm gonna just gently knead my knee with my elbow, right? So I'm just gonna press against my inner thigh. breath. Rock yourself. So, okay, let's say that my right or my left leg is crossed over my right. I'm going to gently pull towards the right. So that left thigh at the hip is opening. You're going to feel that pull against the piriformis. And then bring it back. So you're going to feel that stretch in the outer posterior hip. And now I'm going to do that whilst pressing my elbow into the thigh and my tummy into my back body. And last one. Awesome. And then bringing these in. Let's roll up. So I'm going to choose to roll up with my hands on my shins. We did this yesterday. And start to pull my knees in and then press my shins out. Elbows bend, elbows extend. Okay, so I'm just going to push and pull. For me, that feels good. And try not to let my tailbone tuck. I really want to keep my sits bones facing forward. So I'm getting this solely at the hip. Right? I'm not letting the lower back get involved. And then from here, I'm going to pull my knees in, elbows bend. And I'm going to press my shins, curl my head, and come up. Yeah, there we go. Beautiful. Other leg. So we'll start again with the quadriceps. Just because you can, especially for women, quadriceps are a lot more. So women tend to have they're more front loaded, like a lot of hip flexor issues, and a lot of the quadriceps are tight, and we've underdeveloped hamstrings. And that's honestly, I think, what leads to women are more prone to knee injuries than men. There's a lot of theories as to why. Maybe they say that male sports aren't accommodative to the nature of women's bodies, but really I think it's that we're so front loaded, right? We've got these tight quadriceps, these underdeveloped hamstrings. Really, hamstrings are what's going to keep your knees safe, right? Because the quadricep, and we're just rolling, I'm just talking. You think about like your femur, what's the patella's job? It's to keep the femur from moving out of the body, right? The patella is literally like a doorstop. And then we build all these front-loaded muscles that keep pushing the patella or the femur towards the patella, right? So most of our tears are ACL tears, right? Or ACL issues, or issues with our meniscus, all the things that sit in front. So it's good to give the quadriceps as much of a vacation as possible. In my theory is that we can do it. So this time, I'm gonna have you guys separate your feet. We're gonna just explore the inner thighs. So my legs are separated. Now I'm gonna rotate my heels in so that my big toe side of my foot is parallel to the floor. And now I'm gonna go into the interior part, of my quads. So not quite the inner thighs, but the interior of the quadricep complex. One more breath. And notice if one leg feels more tender than the other, right? That's good, just to be aware. And let's take it on to the other side. So now we're going to rest on so first find your hip, right? You'll feel it's bone. Not that I was worried that you guys wouldn't know where your hip was. And then I'm going to position myself at the top. So I'm going to feel for it. And there's my thigh. So just past the hip. And again, remember what we do. And it's instinctive. Because I know the pain is here, I'm going to hold back because I'm kind of in the ballpark, right? So instead, position yourself forward and embrace the discomfort. And try not to swap tension for tension. So check in with your shoulders. Right? Make sure you're not like, ooh, gargoyling the shoulders and the neck because of the unpleasantness. Karen, I'm looking at your shoulder. There we go. Not to say that you look like a gargoyle at all, not at all. But I know when I did this the first time, I was taking this class with Bo Forbes, who's a fabulous yoga teacher. She's amazing. And her whole work is on releasing trauma through the tissues. So she had us on a yoga block, just holding those 3 positions. And I just wanted to throw up. It was awful. But yeah, but she called me out. She's like, okay, look at your shoulders. Like, she's like, we're trying to eliminate tension, like flush it down the toilet, rather than pull it back into our body, just positioning it somewhere else. Anyway, she's got her whole thing. And then let's move down to this middle point, elemental yoga. It's fantastic. I love her. She's wonderful. She's also I think she's a psychologist as well. So it's nice to see people who have training in both mind and body and can correlate the two. Ooh. And now we come right down just by the knee. Just above the knee. And here's where, remember, we're going to bend. If you happen to have, so this is important, if you've got any kind of knee injury or your like if it feels like your knee is not stable, remember we did this yesterday and I was saying how this knee's wonky, has a hard time controlling itself. I wouldn't spend as much time releasing, right? Because that part of you might be already too released, right? Too gooey. And what it really needs is stabilization. So just to be aware. Good, and then roll all the way the length up and down that thigh. There we go. Right, and this is kind of nice, right? Because now you're ironing out the details. Things like, I think of my mom would make these Christmas cookies, and much like most things, I got too old, so she decided she was going to stop making them because she hated rolling it out because you have to freeze them for 2 days, right, in order to make the shapes. And so that was the job. I had to roll them out if she made the dough. And I think about that because when I roll out, it's like you really have to press and get all of those lumps out of the tissues, right? And kind of flush it out, right? Press it up and then pull it back, press it up, pull it back. One more time. Good. And then lie on your back. Now let's see. Did we effect a positive change? Oh my gosh, pull the knee in. And I dare say we did. Swap it out. And then cross that ankle over your cross the ankle over your left thigh. And again, I'm going to use my right elbow to knead out. Does it have to be? It's not too much. I'm just kind of pressing. Not kind of. I am pressing my elbow right into the thigh. Jackson's in his Christmas. His winter start. We got a couple more breaths.
What's treats?
And then from here, I'm going to gently rock to the left. And that's going to, and think about it. So what are we doing, right? Let's quickly think about that. You're not just rolling willy-nilly to the left. You're trying to pull the left side of your body away from your right greater trochanter, right? The sticky outy bone on the outside. So instead of just rocking your whole body, I'm literally just pulling my left thigh to the left while maintaining or trying to maintain the right thigh and hip where it is. And that's what's causing that release. So one more breath. And then breathe. Ah. And then roll yourself up. However you want to get there. Good. And now cross your legs and just see where your knees land, right? Yeah. Just see where they are. And then there's no right or wrong. Like, when I first started yoga or anything, it was like this, and it was just painful. My hip flexors were just so seized. Yeah. And over time, they opened up, not a lot, but they opened up. So we're going to play with this. So I want you to take a measurement. Take your fingers to the floor. Yeah. And then wherever the palms or wrists or whatever, just note where your knees are, right? Yeah. And so, right. And some of us might be a lot lower than others, and some might be higher. Now look at your knees. Is one knee over the other, right? So just see, okay, is one knee higher? And if you've noticed that, what I want you to do is switch the crossing of your legs and note if that's still the case. So for me, that's still the case. The leg belt was a little higher. Even if I switch the cross, it's still a little higher. So just, again, all it is information. So now what we're going to do, we'll start with the left side since we started with the left side and right side. I'm going to cross my ankle over my right. And I'm going to keep my chest as it is. Yep. And I always think of this in Vegas, like the cowboy. It just is like that, back and forth with the neon sign. That's your leg, right? Everything else is stationary, but your leg moves and it doesn't stop. It's like that Vegas cowboy. And so what are we doing when we're doing this? Right? Let's think about it critically. Well, now I'm starting to mobilize my back, right? I'm mobilizing my spine. I'm mobilizing my viscera. Right? So I'm getting a stretch for the kidneys, the colon, right? I'm getting a little movement, whether I'm on the right side or left side. That depends on which particular organ I'm moving, but you're giving organ motility here, right? Twists, extensions, compressions, right? It's not just the outer surface of our body, right? It's a lot for our health. As we twist, we're gently pulling on one move of the lung. So just to get you a little deeper or a little more introspective to, you guys are introspective. So now, right, so test the waters. How far can you go? Don't push it, but just see, right? How far can you rotate? If the answer is really far, then it's really far. You still have to pay your taxes. But if your answer is like, wow, it's not that far at all, that's okay too. It's what we're working with. So now I'm going to hold on this side. I'm going to keep that hand, so my left hand's going to press down. And I'm going to take my opposite hand to that hip and pull the knee and press the knee. Pull and press. And again, make sure you're not, jammed up in your shoulder. One time, pull, press. Now here's where it gets fun. And that's fun zone, highly overzone. I'm going to come onto that hip. Right now we just mobilize that hip. Now it's like an elbow in the hip, right? Grab hold of your shin and rock. Ooh, remember that greater trochanter I was talking about when we were doing this, right? Like exposing that. Now it's not nearly as gentle. It should feel slightly unpleasant, especially if I know that Beth's on carpet, so, but it probably doesn't make it any better, right? Because it's hard and you're positioning all your body weight into that nexus of muscle that sits on the hip that responds to rotation, or that's responsible for rotation, right? Flexion, all the stuff. Extension. One more breath. Ooh. Now, let's make it more fun. which again, it's a mean euphemism, bring your knees together. Oh, I hate this. And now, so now we're on our glute med, right? We're on that hip, and you're gonna feel a lot more bone. It feels horrible for me. And if you want to, just for, you know, extra bonus points, right? We're gonna just do a little shimmy. And now you've got a nice little corresponding oblique work. Shoulders are down. Ooh. And you want more, we're gonna come out on that hip, hello, and then up, elbow to opposite knee, ah, and out, ugh, and up, ugh. One more time, out, ooh. Oh, it's heinous, and up, and then release. And I know I said this the other day, but I really do think that one leg looks longer. It could be because one leg is longer, who knows. So take a fold. Ah. Oh my gosh, is it amazing? So now let's do the other side. So again, cross the ankle and bend my left knee. And I'm gonna embark. My left hip feels very sad and tender. It's kind of like you ever got spanked as a child and then it's like, I don't want to sit down. That's the feeling my left hip has now. And again, I'm not as focused on how big I can make these movements, right? I'm more interested and engaged with how it feels to bring these movements about while maintaining the stability of my upper body. So and it's not to say that this isn't joyful, right? This is fun, right? I'm still feeling a stretch. But if I'm really methodical, it's like caring for a bonsai tree. Right? Everything is so purposeful that I'm rotating, but I'm not letting my shoulder, my head go with it. So I can feel this dance of the minutia. And because when you're doing that, can you start to feel into the side body as you rotate one way or the other? So now you're starting to bring your mind's eye out of the gross body, right? I'll say it with this one, because I think it's all part, but out of the anatomy of the muscular tissues, right? And into the connective tissue that holds on to our organs, right? All the stuff that's filling these cavities. Right? If we didn't have all these organs, we would just be like one big wind tunnel from pelvis to windpipe. Thankfully, we have a bunch of stuff jammed and crammed in there. So now that we did that, start to see how far you can go, right? Take 2 or 3 rotations. Oh, Jackson, you acquired a hoodie. This is his American Apparel hoodie. I didn't realize this, but it's American Apparel, which means that my dog dresses nicer than I do. One more. And just see, don't force the issue, but just see, oh, can I get it down? Good. And then here we go. We're gonna start with the lateral rotators. So here I go and position myself right up on the hip, find what's not comfortable, grab your left shin, pull it towards you. Mm-hmm. Good. So when I move, it's gonna be crazy because you guys are so used to seeing me in this tiny, tiny but charming living room. And then I'm gonna be filming outdoors by the pool. I have to make the most of this move, as traumatizing as it is. And I'm gonna really go for broke on the visuals. Let's go one more. And then remember, it's not pleasant. Right? And Karen, watch your shoulder. It's actually looking pretty good. Yeah, just that little lift, exactly. And now from here, ooh, look. And here's and we talked about this in yesterday's class. My knees
Press.
right? See how my knees are? This is what wants to happen.
Press.
I'm using my abs. He's fine. He's just on the bed
Come here.
or on the couch.
Come here.
So see how, so look at your knees. It's oblique work. Press the knee, pull the hips back. And that's going to lift your chest, right? It's all connected. And it also makes it more painful. That's why I have my therapy dog right here. Good. Now we're going to go a little bit deeper. And I'm going to extend my legs. And lift elbow to opposite knee. And extend. And roll down. Ooh. Right, roll on your side so that you really get that joy when you're, ouch. So unpleasant. One more. Jackson. Jax. Hey. You're supposed to be here and distract your mom. Good. And then lengthen yourself forward. And again, I'm noticing my fold has gotten a little, so, and when I'm saying this, when I say fold, right, it's not arbitrary. We're working with the legs and then the hips to open up the lower back. So when you're folding, if you're like, oh yeah, that's a little deeper. Well, instead of just being like, yeah, I folded more completely, right? What does that actually mean? It means that now the thoracolumbar aponeurosis, right, that thick connective tissue on the back is starting to alleviate itself, right? Now go ahead and cross your legs. Oh, wait, I forgot to step. So before we cross our legs, let's do this. We've done this before. I'm gonna take my thigh, and you could do this myriad ways. So for this, I'm gonna have my leg in extension just because I'm also trying to work with my back body, and I think this is a little more approachable. So we'll do, actually, sorry, we'll start with the left side since we've been starting with the left side. I'm leaning into my right, pressing my right hand down. Now I'm gonna push my thigh up and press my hand down. As I exhale, I'm gonna relax my thigh. I'm gonna keep the press. Right, and I'm just kind of giving it a gradual, right? Just massage yourself, right? Just give your body some love. And you can, I'm gonna start to move myself forward. So I start back. And now I'm gonna start to move myself a little bit more forward. And you're gonna feel a difference in the stretch. And then more forward still. Now if you see, like I'm really using I'm kind of, I'm tractioning. Jackson, you're kind of harshing them. Seeing them. Okay. All right, so I'm pressing, and now I'm gonna move myself forward. So my hip is down. My hip's down. It's just I started here, which was a little more approachable, and now I'm flexing. And now I'm starting to feel like climb up into my quadratus lumborum muscles, right? And those muscles are so, one, they're massive. Two, they're so important. Three, because they're so big, what happens is tendency is that the QL muscles will be so effective that the smaller muscles, the multifidus or multifidi, that weaves themselves with along the entire length of the spine, they say something like 80% of people have a herniated disc because the QL muscles are so strong that there's atrophy in some of the multifidus or in some of the multifidi, right? So it's training, I don't know, body's so fascinating. Now I'm gonna take my hand, and you don't have to do any of this right here. You guys are really flexible though. But now I'm gonna bring my elbow down, I'm gonna rotate, I'm still pressing. And this feels amazing to me, right? It's like, I think of it, like every time I give a massage, sometimes I'm getting like a massage on my, just because I'm like, ooh, that must feel really good, right? When you put this someone in a twist and then you hold their hip and hold and press on their shoulder and you can just feel their body open up, right? We're doing it for ourselves. See, we don't have to outsource. One more breath. Play with your head, turn your head which way and that, and notice how the head rotating starts to open up a little deeper. Oh, Right? It just drops you in, boom, to the immediacy of the experience. Right? What pandemic? You know. And I notice, and I don't want to say this as a law, but when you turn your head to look on that left shoulder, how does it feel, right? Most likely you're really opening up quite a bit, so hold that. Now nod your head, chin to elbow, or chin to shoulder. And then release. Ooh, it's like you get a little high there, right? So now we'll take them on the other side. That feels so good, just so long. So my left hand is here, right? So I'm supporting myself. And again, I start from what's approachable. And this, so 1 second, it's time for more of my rainbow unicorn. But I'm less phlegmy when I only have my energy drink and not coffee. So this was for me, this was my higher hip. And so it's no surprise that it's also a little more recalcitrant, right? It doesn't really want to go down. So whether this is the higher or lower knee when we measured it, how does it feel? And if it feels cranky, remember how we talked yesterday, I might even give it like a more global massage, right? So if you think about what babies, when they cry, you're not just like holding them really silently and just saying, be quiet, right? What do? Kind of like jostle them about, maybe put them on the washing machine. So when your body is acting like this cranky baby, to me, it just doesn't make sense to be like, just stop. Just be, right? Now I'm gonna be like, okay, maybe if I approach you this way, right? Oh, there's some love. And then what happens is, and you can see it happening right now, the leg starts to be like, okay, right? It's like it acquiesces because it feels safe, right? It feels love. Bodies, babies, it makes no difference. So now I'm gonna hold it here once I feel like, okay, it's time, right? And now I'm gonna move myself slowly. And for me, I'm going slower on this side because I know that this is it's my cranky baby side. And for you, if you're like, this is like a really great side, I feel so good, you just go deep into it, right? But for me, when I do this and I feel that architectural line, and it's moving up the inside of my leg, I'm not quite sure if that's my, oh gosh, Sartorius, right? If it's just a groin muscle or tendon or ligament that feels cranky and it's manifesting itself into the rest of my soft tissue. But I just feel like there's this point which I say, are my legs telling me to stop? My hips telling me to stop. So what am I gonna do? Hey, baby. I'm just gonna massage where it feels a little bit tender. So again, if you're having that same feeling, work with your body. Don't work against it. If you're feeling, yeah, it's nice, Beth, right? And it's soothing. And I'm gonna get more, right? Your body's not, you're not a stage mother to this body. I'm gonna move with it. Now, it feels okay. I'm gonna go into that full expression. And I'm gonna, if you notice, I'm gonna just wiggle my hips a little bit just to settle my thigh. Now I'm gonna turn my head up and down. Karen's on the move. Up and down. Okay, so I have that press. And now again, when I look up, I want to feel into it, right? So now we're going to take our hand, pull in, and go a little deeper. Turn the neck, rest the thigh. And the top shoulder, because I'm locking the joints out to get that real deep press, that shoulder is going to be by my ear, and I'm okay with that. The bottom shoulder, try to release it if you can. And one more time, hold, breathe. And slowly up. And we'll bring our legs together as low as those things work. Just bounce your knees. Bounce, 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 bounce. Now let's do the true test. Ba-ba. Right, I got a little lower. Before I could feel the bony part of my knee was past my palm. Now it's right here, right? So I can say it was like the most significant change. I didn't grow 4 inches, but I can feel the efficacy of that. Thumbs up, thumbs down. Any change? Yay! Okay, awesome. Let's switch across. Right, we want to make sure it's not a fluke. And I'm happy to report similar results, right? So again, we did our IT bend, we got flexion. We did our outer hips, and now we have lateral rotation. So that's all creating space for the spine. Let's bring ourselves, I always keep this over. So here's where I want to come against. So see how my shin is perpendicular? Floor. And I advise having your pillow. Where's my pillow? I'll just take part of this Jackson's bed. So I'm going to bring my shin so that it's against my sofa. You could do this against a wall. And I'm going to bring my other foot forward. So, and you can start with your left leg. I'm starting with the right just so you can see. And I'm going to round back and lift my head. Round and oh, it's horrible. And I want to explore something that moves with my body. So, and I'm doing this, I'm just kind of making this the express mode, just for timing. So you could do this and then hold, right? So let's play with that in a second. First, now I want to make circles with my hips. Right, so, because what's going to happen, right? Life doesn't happen in 1 degree, right? It's every degree. So I don't want to approach my thighs or my hips or my issues from one range of motion. And then again, once I feel like I've done enough, now I'm going to come up, reach my arm forward, round. Okay. So I'm reaching my arm forward and round and pull in. Lift up, take my hand to the center part. So I'll show you where my hand is going. I'm lifting up in my lunge and my hand is coming here. And now, and I can't show you and do it, so what I'm gonna preface this, right? Hand to my thing. I'm here, right? My leg's here. My shin is up, not on the floor. It's just for visual, so you can see my shin is against the wall or against the sofa. I started here, and then I opened, hand back, and now I'm thinking elbow and knee are working away from one another. So press your shin down, or I mean your knee down. Lift your elbow up. Whew. God, lean without tucking your tail, right? Without doing this, because that's just going to push the thigh forward. Lean forward. And then slowly come out of it. Oh my gosh, to come out of it, God, it's like it's a Hail Mary, right? It's such a deep, impactful. Down, I just turned to the side. Oh. And now here I am. So now I'm on this side. And I'm lean back and forth. Okay? And you're going to feel this a lot at the groin. So leaning and backing up. And I'm trying to show you from the side so you can get an idea of where my hips are. Right? It's like a spider stretch from Pilates. And I think, I love the stretch. And when you do it on the reformer, it's amazing. So if you're on the reformer, right, your foot is on the foot bar, and then this foot is on the floor, and your hands are on the carriage going out and coming as close in, right? And it's phenomenal. It's so good. One more. Good, last one. Hold it here. Shoulder as close as you can get to that knee. If you can, even bind and drop your head. Good, bring it back. Let's take a down dog just because we've been sat down the whole time. So let's take a down dog just to kind of give some relief to our hips, to our lower body. And then we're going to take that same stretch in the opposite leg. So bring ourselves down. Take our knee. Slide the shin up the wall, sofa, what have you. Bring that other leg in front. Bring this up. And again, from here, I'm going to round. I'm going to look up and round. And then I'm going to go and I'm going to like make my circles. Right? Or maybe you want to just kind of go to one side and then go to the other side. Right? There's no have to's, supposed to's. You're just exploring the body. And again, you can do this as long as you want, but just for brevity's sake. It comes up, first thing. So I'll show you, again, I'll show you this way just so you can see. Imagine my shin is still against the wall. I'm going to do, right, this action. So I'm going to reach the same shin that's up against the wall is the arm that comes forward. I'm going to round like I'm trying to throw up from my bladder. And then from there, I'm going to keep that lifting and stretching. The hand comes here, right? And I want to think knee down, elbow up, chin back, ribs back. And then breathe as deep as you can. And I know it's a lot, but if you think about it, participate with the experience so it doesn't feel like it's happening to you. You're actually happening to it. Okay? Which is a good take on life, especially these days. One more breath. Right? Open the whole front of the body. It's so intense. And then you're gonna let it go, right? And again, to let it go, what are we gonna do? Sorry for the butt. I'm gonna come to this side. Now this leg up. And again, I'm doing my spider stretch. So you'll see I'm gliding my whole body. And I'm not tucking my tailbone. I want to keep my pelvis prominent. I want to keep my sits bones really perky. I want to keep the pelvic floor open. And other way, not confused there. Right? So I'm coming in and stay low. So think of it this way. It's like you're army crawling, right? Yeah. So instead of lifting your hips and making like an arc, keep your pelvis like a typewriter. Right? And keep your butt perky. Because if I tuck my tail, it's just going to change the movement. And again, I'll show you if you wanted to do this. If you had a couch or something, I know some of us are working at the wall, but you had a couch, right? I'm going to bring my shoulder and then press out, right? So I bring my shoulder. Yeah, and if you want to try it. And if it's like too much there, take it to the sofa, right? That's okay. Same thing. And I think it feels so good. It's so good for the low back. So good for the psoas. One more time, wherever you are, right? If that's foot on the floor, foot on the sofa. And then I'm going to hold wherever I am, right? Wherever you decide to be. And I'm just going to find that bind, if I want it. I can drop my head. And this is my sensitive side, so I'm going to give it a little massage because it feels tender. Right? And then again, let's bring it into your downward facing dog, top of toes. Pull out your knees, let your hips shift side to side, let your gaze go with your hips. Good. One more time. Bend your knees, lower down, maybe take a cat-cow. And then release out to one side. And let's just see, how's our fold feel? Do we feel any tension? Up. I'm just going to take some rotation side to side. I'm going to hold on to either elbow. Reach my elbows back, pull my ribs down as my arms go back. So there's that tone. And then from there, I'm just going to relax. Let my legs go. I can keep I like having my arms overhead. It just makes me feel happy. Like I'm pulling muscles that get easily stuck, right? But you can keep your arms over. Just take notice, take stock. Good, and then let's do this. Bring your legs closer together, but not all the way touching. Hands behind your head if you can. Elbows are in your peripheral gaze, not all the way up, just in your periphery. Reach through your big toe, and your big toe reaches. And then see if you can all the way up. And the goal is, is when you relax your hip flexors, that becomes a little more graceful. So that